In our report, Volunteering in America, the Social Capital Project outlined volunteering trends in the United States. Americans are just as likely to volunteer today as they were 40 years ago, if not more so. In times of significant need, such as during the current COVID-19 pandemic, volunteer efforts may be especially important. We've seen countless examples of volunteer efforts that are taking place across the nation in response to the pandemic. These include restaurants donating free meals to those in need, seamstresses across the country volunteering their time and resources to sew face masks, along with churches and other private organizations coordinating similar efforts. Numerous volunteer grocery shopping and delivery groups, helping the elderly and other vulnerable groups get the food and supplies they need without having to leave their homes. Financial institutions donating money to local restaurants to help them stay afloat. Nonprofit organizations donating electronic devices to the elderly so they can stay connected to family members via technology. Individuals organizing social media donation campaigns to help people pay their bills. Groups providing gardening supplies and plants so community members can grow fresh food. Although volunteering takes place throughout the country, it's more common in some states than others. Utah has the highest share of volunteers in 2015, with 30% of the state's population being involved in volunteering. States with higher rates of volunteering also typically have higher levels of other types of social capital. Policymakers at the federal, state, and local levels can support volunteer efforts by reducing regulations and ensuring that government programs don't crowd out communities' efforts to reach out and help one another.